Hey guys, and welcome to my episode 1 of my Intern Diaries. So my name's Sil, I'm starting as an intern, as a junior doctor in Australia, in Sydney, Australia, and I just started this week. In this series, I'm going to be making a set of reflective videos in an effort to A, improve my reflective practice, which I think is really important, and B, I always found that reflecting helps slow time down. So depending on where you are in life, you might have started to have these experiences where you just kind of go, whoa, that was a year ago? Whoa, those 3 months went by really quick. And just seeing time pass. And I think that's a consequence of many things, but one of the things is essentially not slowing time down, because you just keep living in the present, and if you don't reflect on what you've achieved and what you've done, your remembering self, as opposed to your experiencing self, remembers poorly and time just flies by. So anyway, with that rant over, I'm doing this to slow time down, and maybe one day it'll be nice to look back on. So week number 1 as an intern in Australia. So it's worth mentioning how people used to start medicine, and after talking to my consultant, it's pretty comical how bad it used to be. It probably wasn't funny for the people that experienced it. It was probably really overwhelming and horrible, but just to see how far things have come, it's like, I don't know, laughing is the only reaction I know how to do to these kind of things. So what used to happen is you'd arrive day 1 as the intern, and they'd give you a pager in your hand. Maybe if you're lucky, give you a tour of the hospital, but usually during the tour of the hospital, your pager would start beeping off, and they'd say, go, that's your pager, that's your job, you answer the pages, go. And then you hit the ground running. You learn as you go, you learn by making mistakes, all these things that are not healthy. Also, there was definitely not safe working hours. People were doing 32-hour shifts and sleeping at the hospital, but not even sleeping well and making mistakes, and it was all terrible. Nowadays, I can only speak for my orientation, but this is pretty standardized. We have basically 2 weeks of orientation. So the first week is really orientation. It's the lectures. So we're learning about the electronic medical record and how to order things. And for me, that's pretty easy because I've been a student at the hospital that I'm going to be an intern at. For others, that's pretty overwhelming because they've never seen this type of EMR, we call it, an electronic medical record. And so they're learning from scratch. The other lectures are just telling us about how the hospital is structured, who the doctors are, what are the teams, what are the hours, that kind of stuff. The housekeeping, I guess. And then we have to do online modules, and these are like where you learn about cultural differences. So I work in a really multicultural district of Sydney. You call it an LHD technically, a local health district. And we had to do lots of modules on different cultures, and especially Indigenous culture, which was a 2-hour module that was actually really good. I know some people didn't like it, but I thought it was pretty interesting, and it made a good point of how different cultures can perceive different behaviors as rude when they're trying to be polite. And so you kind of don't really know what other people are thinking ever. So always be empathetic, I think, is the takeaway from that. And then we got to meet our team, which was very exciting. For the first term, I'm working in a psychiatric rehab unit, which is the kind of area of psychiatry where people have these long-term conditions, really complicated stuff, like not just one mental illness, but multiple. And they're just not quite there yet to live in the community. They're just still a bit unstable psychiatrically, but they're medically stable. And so they're off the kind of medical ward, but if they were to go into the community again, their psychosis might relapse or things like that. And so they essentially are in this kind of living unit. It's very nice. They have beds, they have their own rooms, of course, and then they have this beautiful outdoor area. They even have a massage chair, which I'm a bit jealous of, and hopefully as I work my way into the team, I can get access to that massage chair and maybe just work from the massage chair. Anyway, I like massages and I like massage chairs, so I should move on from that point. It's going to be really interesting for me. There's pros and cons. The negatives of this term are it's not high pace medical intern stuff where you're seeing 50 patients a day, they all have different medical conditions, and then you're getting called all the time to review different like abdominal pain or headaches or yada yada yada. And that's really useful as an intern because then you can learn a lot and ask a lot of questions. There's not that much of that. You get maybe 2 or 3 calls a day from patients for medical issues. But you don't even write the discharge summaries, which is the document that usually interns write when someone's leaving the hospital. Because these people are so complex with multiple things going on at once that are, psychiatric and social and, super complicated. Usually it's the registrar that writes the discharge summaries. I'm going to try and offer my services to do that and try and get a bit more exposure because I'm interested in psychiatry. So hopefully I can do some of the kind of registrar's jobs. For those of you who don't know what a registrar is, by the way, in Australia, the intern is the kind of lower chaired entry-level doctor. Then you get registrars, which are the middle chair doctors, but not yet consultants. And then there's the consultants at the top. So yeah, it's pretty well supported because there's a couple of registrars and a couple of consultants, just one intern. And I can always ask for help for things. And what else happened? Oh, and the most exciting moment, I guess, of the first week was writing my first prescription. So that's a big event in life. I never really called myself, I was never comfortable calling myself a doctor. Even though this channel is now called Dr. Sil, I still didn't really like it personally because I feel like a fraud. But there's a lot of imposter syndrome and you work through that. But writing my first prescription now, I guess I feel like a bit of a doctor because that's a prescription. I feel like a glorified drug dealer actually, but hopefully I know the side effects and the patient's profile well enough so that I'm not just giving people bad drugs. I'm giving them good drugs, the ones that help. Hi, you want to come up and say hi? And then on Friday night, we had socially distanced, COVID-safe drinks with all the interns in this outdoor pub area thing. So it was nice to meet everyone else. It's pretty funny, how diverse a group we are with different experiences, but we're all there for the same reason, which is to improve patient care and all that good stuff. This is Albie, by the way, if you haven't met him. He's my pup. He's very fluffy today. Usually I give him lots of haircuts, but my girlfriend wants him to be fluffier, so I'm not cutting him as much. Also during this week, I met another UNSW student called Prithvi, who's starting his own YouTube channel and has already released a really cool vlog. So I'm going to link to that in the description and on a card here. You guys should definitely check that out. So that's it for this video. I'll see you in the next episode of the Intern Diaries. And next week will be much more clinical. I'll be spending the whole week with the team. So I'll have more stories from the ward, obviously all de-identified and depersonalized and sensitive, but you'll hear more about what it's like to be on the ward as a junior intern. Okay, that's it for this video. Have an absolutely lovely day. Bye for now.